So hello everyone. So genetic disorders can affect any blood system in the body. Likewise, it can affect eye also. So in fact, there are many diseases which affects the eye, which can be of genetic in origin. So unfortunately, awareness about these genetic problems is not that among general population. So there are many diseases like I said, retinitis pigmentosa, which can cause night vision problem, or Stargardt disease, which can cause central vision problem. Likewise, there are many retinal disorders which can be of genetic in origin. So, unfortunately, there is no treatment as such for this condition, but there are some a few clinical trials which are going on, and there are some few approved treatment also for take a form of gene therapy. So it's very important, whenever you are suspected to have something with some genetic origin, to get a genetic testing done. By undergoing genetic testing, we get to know the root cause, the causative gene which is causing this problem. So sometimes immediately you may not be able to offer any treatment as such, but it will give us a guidance in the form of what exactly is happening with respect to that particular gene, with the form of research. If there is chance of next generation getting affected because of this particular mutation. So those information can be obtained by undergoing a genetic testing. And also, it's very important when you are diagnosed with something genetic to get a proper clinical evaluation done. Because genetic testing is not like a simple test the way we do that test for sugars and all. So before, whenever we subject any patient for a genetic testing, so they need to undergo a thorough clinical examination and necessary investigation, what we call it as a deep phenotyping. Then accordingly, a clinician will recommend which genetic testing is suitable for you. So for example, for eye, we use something commonly called the clinical exome sequencing. So depending on the reports what we get, you may have to repeat the test sometimes, because sometimes we get the gene which is responsible for the condition, but sometimes we may get inconclusive reports, in which case we may have to do a repeat testing. So there are many, the labs which very good at, genetically this genetic test reports. We commonly send it to MedGenome, but likewise there are many other labs also. So what I strongly suggest is, once you are suspected to have anything this of genetic origin, please do a thorough examination. Get your family members also screened. Don't forget to, undergo a thorough genetic counseling followed by genetic test.